glide mobilization. So this is going to be somebody who is lacking flexion or extension at the elbow. We can do it for both. So I'm going to have you lay on your back. So we will have already assessed all the wonderful things, strength, and done all the stuff. So we're looking at a restriction in flexion or extension, and oftentimes you can test whether or not this is going to be effective with some of the assessment techniques you guys already used. So for example, the push-up, if that was something that was painful and you found that kind of applying a glide was comfortable in that position, you could use something like this is likely going to be effective because you'll see where the placements are. So the belt, you want to be distal to the elbow, so it's going to be in that proximal radial ulnar position there. All right, nervous? No, you're okay.
I never had this done.
So, so belt goes around the waist for this one. The second one is going to be around the shoulder. So when you guys are differentiating these techniques, belt is around the waist. I'm a taller guy, so I would love to be a lot higher. I'm going to get a pretty good quad workout right now. So you want to be able to, you want to use your butt to do the glide. So this is going to be kind of right around that gluteal fold under those ish tubes there. If it's a little bit higher as you go, it's probably going to slide up your back. So it's going to be a little bit different for everybody, but you want it to be able to stick. So usually I'll use a towel for comfort for the patient because the belt can get a little bit uncomfortable on the kind of rubbing, kind of burning the arm. But you're a tough guy, so you can handle it. So handling. So my glide, I am going to be doing the glide, like I said, with my butt here. So it's going to pull out laterally. So it's going to be a lateral glide of the elbow. We're going to be doing extension, so we're going to kind of be in this anatomical position with the forearm up, but you could change that. You can bias this any way you like that allows for them to get rid of their comparable sign. So first, I'm going to have to get on his plane. So my right hand is going to block his distal humerus here. So I am not necessarily pushing in, I am stabilizing here. So I am just not letting it come. So I'm holding here, and I'm holding here, and my butt is going to glide. And again, I want to be on this level laterally. You okay?
Yeah.
Okay. So I have now initiated a glide just by leaning a little bit backward into the belt. So my hands are providing 2 points of contact, stabilizing laterally. So we have a glide. The key with the movement, so your body mechanics, is going to be kind of a side bend, rotate, because we're going to have an issue with his carrying angle. So when I come here, I can flex and side bend and maintain my glide. When I come here, it's not anatomical coming straight down. So in order to allow for his carrying angle to stick, I actually have to rotate as I come in here. Otherwise, I'm going to be in the way with my leg. So for extension, we glide, and we're going to come down and rotate. This is actually really difficult technical technique to get. So just play around with the belt loop. How wide is it? Where is it placed? Where are your hands placed? And come on down this way. So to improve flexion, we're side bending, rotating toward. To improve extension, we're side bending, rotating away. And I'm keeping that glide the whole time. Terminal extension is going to be really, really tough to get here. Probably have to play around with table height. The other thing is, where is this hand placed? So generally, Mulligan likes to have you inside of the belt, like this, here. For some of his techniques, it's a little uncomfortable. I feel like I'm losing a little bit of my glide. So for the purposes, and I'll let Dr. Rush know what we're doing, play around with both, but do whatever's most comfortable for you, because I don't think it has a huge effect in your ability to apply the glide. Okay? Anybody else need to see that again?
I see flexion.
So here. So oftentimes what I'll do, because to stabilize here, I'm doing a lot of using my arm, is I'll hook this inside my ASIS, really the table would be higher, and I'll hold it there so I don't have to push. It's just stabilizing here. So I'm rotating and side bending as I come with for flexion. You okay?
Is the belt essentially, is it allowing the like distraction the whole time? Is
Yes.
that what it's, so that's
So
the,
you're keeping that pressure back the whole time.
right, because otherwise,
It's kind of like that biomechanical correction we were doing before, right? Except we're using the belt as a,
Correct.
okay.
So the belt is essentially my third hand,
Yes.
right? So I need to stabilize here, I need to stabilize here, but then I have nothing to apply the glide.
yes,
That's where the belt comes in.
okay.
All right. So that is, you guys can stick around.
Dibs on lumbar.
So that's the lateral glide MWM to increase flexion extension. So the tennis elbow. Yep.
No, I didn't, because there are several clickers, so I didn't know if we got
Yes,
that
3 clickers over here. So one of them works. So this one is going to be tennis elbow, MWM is what it's called, lateral epicondylalgia. That's what we're now using our new terminology here. The painful wrist extension or painful gripping. Those are going to be your 2 indicators. So just remember as you go, this should reduce the patient's pain actively while they do it. So supine, extended, and pronated is where we're going to be. So you're actually, for this one, I'm going to have you scoot over a little bit to your right, actually. You scoot away from me. The belt allows for my body mechanics to let him be a little bit farther away from me as I need be. Pronated, so the hand is down, otherwise extending is just going to be helped by gravity, so we're going against gravity. Okay. So more people are going to have, is there a picture here?
Yeah.
So more people are going to have difficulty in full extension of their elbow. They're going to have the pain resisting extension in that position versus in a flexed position of the elbow. Probably has to do with the mechanics of, you guys know what the tendon is, right, for tennis elbow?
ECRB.
ECRB, right? So that extensor carpi radialis brevis point here, slight elbow flexion, maybe takes a little tension off of it, maybe takes a little slack off of it, but most people have the most pain when gripping in full extension. So carrying something in their hand is common, and then that backhand. So full extension of the elbow, extension of the wrist. So we're going to assume that I had you kind of bend up here and your wrist cracks. Hold it right there. Don't let me push down. That was painful. So that is our comparable sign for this mobilization here. So you're going to lengthen out the belt because you're going to be using kind of this over-the-shoulder grip here in the belt. So the glide that you're applying is going to be superior lateral because we're here. So this is described as a lateral glide of the ulna, or a superior lateral glide of the ulna, saying that it's positioned incorrectly. We're repositioning it, so we're correcting that positional fault. But we know that the line of the ulna changes as we pronate in that position, just like we did before. My Rambo belt. So we're coming in here. Again, the table doesn't really move, so we're same starting position for the belt, which is going to be just distal to the elbow joint or on that proximal radial ulnar joint. Our contact points are going to be the same on the humerus and the distal part of the forearm to stabilize as we pull. And because we've rotated his forearm into that pronated position, so be a little bit above, kind of superior lateral here and here. And all I'm going to do is kind of extend my knees. And as I do this, I can also just kind of straighten up a little bit, and that's the direction of pull. So straight up is a little bit lateral, and then if I come back a little bit, you can change that direction of pull, just by a little bit of a knee bend. You want to keep that glide. So then you would have him extend your wrist. Oh my gosh, that doesn't hurt anymore. And you can put a weight in the hand. You'll probably want to start in a little bit more so you can vary how much flexion you have the elbow in. So if it's really painful and full elbow extension and wrist extension, just flex a little bit. Or you can have them raised up a little bit in this position here, and then you gradually work them. If you say, all right, can you do this? Can you extend your wrist? Okay, that's pain-free, relax. You say, okay, how about now? Try it again. Oh, that hurts? All right, so we're gonna find that pain-free range. We're gonna do 3 sets of 10, as long as it's pain-free. And then we're gonna send them home with some kind of home exercise program.
You find the pain free before you even start to do your reps, right?
So
Like,
you
gotta
won't,
find
yes,
it.
correct. You won't do reps if it continues to be painful. So if you change the flexion angle and the extension angle and your glide force and direction and the pain is still there,
You can't.
got to find a new technique.
Okay, that's what you were saying.
So that's a tennis elbow MWM. This one is really, really nice. These two techniques, this one especially, they solve the problem there, and sometimes the problem stays solved or it gets solved relatively quickly. Sometimes you're going to have somebody who feels great when you do the glide, and they feel great for a little while after you do the glide, and they come in next time and their pain is kind of back to normal, so you do it again and they get complete relief, but their pain keeps returning back to where it was before. Got to find a new technique. So I'd say one happens about as often as the other happens, just personally in my experience. But the ones where you have a good effect of it, it's really, really nice because it's quick. So usually, 4 sessions or so, a couple weeks, and they're doing pretty well with it. The home, you can come sit up here. The home exercises for this uses a wall or a door frame or whatever you want to call it as your stabilizing hand. So it's not nearly as effective, but what you would be doing is kind of using the wall to provide your glide. Let's see. What am I doing here? And you're kind of pushing into the wall to get that lateral glide and extending up. But there are a few different ones. I want you guys to practice the belts first. We only have a certain number of belts, so there's more? Okay. So you can use a gate belt if you can. Practice with the belts, and then we'll go over the home techniques. All right?